Hello, my name is Dr. Sohail Bhatti. I'm the Interim Director of Public Health for NHS East Lancashire. I'm sorry I can't be with you today due to personal reasons. However, I don't wish for you to take this as a lack of commitment either on my behalf or on the organisation's behalf. SMYL, which is our abbreviation for our health inequality strategy, began its gestation in about 2006 and was specifically targeted at tackling the vast areas of inequalities that are found in some of the most deprived areas of England. We have, particularly in East Lancashire, a problem with some of the most affluent areas, such as in Ribble Valley, sitting almost adjacent to some of the most deprived areas, such as Burnley, which, according to the 2007 Index of Multiple Deprivation and the 2010 indices are actually due out, I'm led to believe, but in the 2007 indices of deprivation, Burnley actually is, I believe, the second most deprived, if not the first most deprived district in the country, and that's England. Obviously, the board took SMYL to be a major priority area. We started off calling it 1 million years of life saved, which was devised as the equivalent of 2.6 years of life on average for the 386,000 residents we have. The National Support Team for Health Inequalities visited us and pointed out that SMYL could actually be rejigged into SMYL, and hence we began what became SMYL. If you visit our HQ in Walshaw House, you'll see we have a flag, SMYL, and we are told that the actual banner and message is one of the most highly recognised in the Northwest as indicating health inequalities and is associated with NHS East Lancashire. These are no mean achievements. However, one of the criticisms that the board made in about 2.5 years to 3 years after the start of the programme, which started with 6 areas, I believe, including tobacco control, alcohol reduction, infant mortality, drugs, as well as cardiovascular disease, was that not enough progress was being made. A SMYL review was then conducted externally, and it was established that a whole rejig of the programme was needed. On my appointment, I was told my first job in 2010 was to present the rejigged strategy. It was my rather sad duty to tell the board that by 2011, which was our target date, it was highly unlikely that we would achieve our 1 million years of life. However, the strategy that we rewrote had within it the seeds of its potential success. We had at that time, May, June, recognised with the new coalition government that we would have to take account of the planned reconfiguration. We therefore recognised and embedded the principles of SMYL within primary care, which felt both appropriate and right, as one of the criticisms that had been made against SMYL was that it seemed to be a very PCT-led strategy, though of course we did work with local authorities. Now, SMYL is about SMYL 2, which is the rejigged strategy, is about embedding the principles of SMYL as well as providing an evidence base for improving health inequalities. It has a number of key areas which are linked very much to clinical care as it takes place in primary care. Primary care, by the way, we mean by and large to be services that are provided in and around general practice, and the kind of activities we suggested that could be done. It included vascular checks, included stop smoking advice, included vaccination, immunisation, a lot of screening activities. Again, our strategy tended to predate what later came out in the white paper from the government, but very much was consistent with our basic principles. Now that's the history lesson over. It's suffice to say that we now do have a SMYL 2, and we did promise, and I'm grateful for the opportunity to have a formal launch event. We had planned in December to have this launch event, but unfortunately we were unable to hold it then due to inclement weather. However, we're back in Burnley, Burnley Football Club in Turf Moor, and I hope that you will enjoy the remainder of the event. We did have a preceding event in January where we held a workshop where over 112 GPs attended. We encouraged them to develop their own action plans in terms of reducing health inequalities, and the vast majority of whom did. Now obviously they're not going to solve health inequalities by writing an action plan, but for me the representation of interest and the degree of commitment that people had to fill in action plans as well as participate in a workshop demonstrated the strength there is in East Lancashire. As we know, we're being reconfigured, so it is therefore heartening that people who are responsible for our care in East Lancashire, who are not likely to be affected directly by reconfiguration, though their roles and responsibilities might change, have given it such a high priority. We also undertook to deliver a broader event that was targeted at a wider audience than just general practitioners. So we are aware, for example, that general practitioners on their own, though they are highly effective and work very hard, aren't going to be able to deliver health inequalities no matter how enthusiastic they are. They will need a team, and they will also need to work with others. This is the purpose of today, which is to bring together representatives from the local authority, representatives from the provider community trust, as it is now an arm of NHS East Lancashire, as well as Lancashire Care Trust. These are health visitors, school nurses, district nurses. They often provide the day-to-day contact along with practice nurses for the majority of patients. Practice managers are obviously very key in terms of delivering on what practices are supposed to deliver. They in effect organise how practices work. We've also gone out and tried to get, and I've been heartened how successful we've been. We've managed to get pharmacists who themselves have a role as a point of contact by patients when they have a problem. We've also managed to get some elected councillors and a variety of other significant, important people. So, what is it that is bad about health inequalities for our population? Everyone knows that